Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hi everyone, this is Nitin Choda with www.intouchemr.com, and in this video I'm going to tell you about Physical Therapy Billing Software 101. What should your physical therapy billing software do for you? Your physical therapy billing software should simplify every aspect of the claims process from start to finish. Now here's what I mean by that. The moment the claim is generated from that particular visit, which is documented by the physical therapist or the clinician in an EMR, that particular claim should be scrubbed. So we're talking claim scrubbing. Now what do I mean by claim scrubbing? I mean that the claim should actually be checked for the presence or the absence of all the different modifiers. We're talking modifier 59, the KX modifier if it's applicable. We're talking about the functional limitation G codes, PQRS measures, and any other modifiers that are associated. For example, the functional limitation G codes are associated with severity modifiers. Certain PQRS measures are associated with modifiers. So the claim scrubbing actually checks the claim to see if any modifiers are necessary. There's actually more to claim scrubbing than that. There needs to be ICD and CPT code compatibility. For example, you can't bill a hysterectomy for prostate cancer. So that's an ICD CPT code incompatibility. So the ideal software should actually scrub your claim for compatibility between the ICD and CPT codes and check for the presence or the absence of modifiers. That's what claim scrubbing is. Once claim scrubbing is done, the software should transmit your claim over to what I call the clearinghouse. Now a clearinghouse is basically a company or a service that takes your claim from your billing software electronically and then transfers it over to the actual payer or the insurance company. Think of Visa or MasterCard. Visa or MasterCard actually simply take the money from your credit card or from your bank and transfer the money over to the actual merchant, and they make a little bit of a percentage or a commission along the way. They get that money for doing that. Similarly, a clearinghouse simply takes the claim from your billing software and transfers it over to the actual insurance company or the payer. Does that make sense? So once this actually happens and the money goes on over to the actual payer, so we're going to put in, now when I say payer, I actually mean the insurance company. Now at this point what the payer does is when they get the claim, they have to, they have to make a payment, or they may sometimes deny the claim, or they may ask for more information from the claim. That's where the strength of the documentation is important. That's where the scrubbing helps you minimize claim denials. But this is where it gets important. The payer returns what's called as an EOB or an ERA. An EOB is called an explanation of benefits. It gives you more information about what the patient's benefits are, about how much was paid by the insurance company, and other information. The ERA, which is called electronic remittance advice, is the same as an EOB, but the only difference is that it is a digital version of the EOB. Now once this information comes back, your billing software should be able to automatically take the information from the ERA and apply it to the patient record. And by the way, IntouchEMR.com's billing software does do that. So again, the good news for you is we actually do that for you automatically. In fact, one of the biggest mistakes that I've seen most billing companies make and most billers make is that they actually take the EOBs or the ERAs and they manually take all the information from the EOB or the ERA and then apply it and post it. That's a lot of wasted effort. You can actually simplify and automate all of that with IntouchEMR.com. Now once EOBs and ERAs come back, then you can then the billing software should be able to either let you generate a secondary claim if the patient does have a secondary insurance, or quite simply generate a patient statement. And once a patient statement is generated, what you're doing is you're actually transferring the responsibility of whatever money is owed by that particular patient over to the patient. So basically what that means is, let's say you're generating a claim, it goes to the clearinghouse, the payer, let's say, pays $80 out of $120. If there's no secondary claim or if there's no secondary insurance, the remaining $40 actually becomes patient responsibility and is generated in the form of a patient statement that's then sent on over to the patient. It's mailed over to the patient. So the ideal billing software should automate and streamline every single aspect of the payment cycle, should shorten your revenue cycle and make your life easier. That's exactly what we do at intouchemr.com. So make sure you go on over to our website at intouchemr.com and ask us more about our physical therapy billing software and how we can streamline and automate everything for you and shorten your revenue cycle management process. We'll also send you a free report, a free full color report, an executive briefing, if you will, on the 5 blunders associated with EMR. Thank you so much for watching. I hope you found this video beneficial, and make sure that you come back to our YouTube channel for more videos, because we have several additional videos that will help your practice. Thanks so much for watching.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.